Somewhere right now, a woman in her mid-40s is lying awake at 3 in the morning, sheets damp, heart racing for no reason, wondering why her periods have gone from clockwork to completely unpredictable, and nobody ever properly explained why. Here is what almost nobody told her. In November 2025, the FDA formally removed decades-old warning labels from hormone therapy, an official acknowledgement that a lot of what women were told about their own hormones for the last 20 years was built on a misunderstanding of the original research. By the end of this video, you will understand what is actually happening in PCOS, perimenopause, and menopause, and I am going to be honest with you about which popular hormone trends like cycle syncing actually hold up. Quick ask. If this kind of honest, well-researched women's health content matters to you, hit like, subscribe, and tell me in the comments which part of this topic you want explained more, PCOS, perimenopause, or something else entirely. It genuinely shapes what I dig into next. Let's get into it. PCOS, the condition hiding in plain sight. Let's start with a condition that affects an enormous number of women and still gets diagnosed inconsistently. Polycystic ovary syndrome, PCOS, is fundamentally a hormonal and metabolic condition, not simply a description of cysts on an ovary, despite what the name misleadingly implies. Here is the actual mechanism worth understanding. In PCOS, the body typically produces higher levels of androgens, hormones like testosterone that everyone has but that are usually kept in a tighter range in women, alongside insulin resistance, meaning cells respond less efficiently to insulin, forcing the pancreas to produce more of it. That excess insulin, in turn, can push the ovaries to produce even more androgens, creating a feedback loop that can disrupt ovulation entirely. Picture that loop actually happening inside the body: irregular or absent periods, acne that resists typical treatment, hair growth in unexpected places, and often a frustrating resistance to weight loss despite genuinely consistent effort, all connected back to that same underlying insulin and androgen cycle. Here is the myth worth killing directly. PCOS is not caused by eating the wrong foods, and it is not something a woman brought on herself through poor choices. Current clinical reviews describe it as a condition combining genetic and metabolic factors, and research explicitly notes there is no single best diet composition proven superior for the many different aspects of the condition, hormonal, reproductive, or psychological, despite what specific branded PCOS diet programs frequently claim. What does have solid evidence behind it is more strategic than restrictive. Research has found that eating a larger breakfast and a smaller dinner, rather than the reverse, is associated with improved insulin sensitivity and lower androgen levels in women with PCOS, which matters because research also notes women with PCOS often skip breakfast entirely or eat their first meal much later in the day. A Mediterranean-style eating pattern, rich in unsaturated fats, fiber, and antioxidants, is consistently endorsed across international guidelines as a genuinely supportive approach, not because it is trendy, but because it directly addresses the insulin resistance sitting at the center of the condition. Clinical guidelines also emphasize something easy to overlook: PCOS carries a real, elevated risk of anxiety and depression, and current best practice explicitly calls for screening mental health alongside the physical symptoms, not treating it as a separate, unrelated issue. This is general health information, not personalized medical advice, and PCOS varies enormously from woman to woman, so working with a doctor familiar with current international guidelines matters far more than following a generic program found online. Perimenopause, the transition almost nobody explains properly. Now let's talk about a phase of life that affects nearly every woman eventually, and that a striking number of women move through without ever being told what is actually happening to them. Perimenopause is the transitional window leading into menopause, typically beginning in the mid to late 40s, though it can start earlier, and it can last anywhere from 4 to 10 years. During this time, estrogen production does not simply decline in a smooth, predictable slope. It fluctuates, sometimes wildly, spiking and dropping unpredictably before eventually settling into consistent decline. That erratic pattern, not a steady drop, is precisely why symptoms can feel so unpredictable and confusing. Picture the lived experience researchers describe. A period that used to arrive every 28 days now shows up after 24, then 41 with no clear pattern. Waking at 3 in the morning, sheets damp with sweat, wide awake with a racing mind. Joint aches that do not match any clear arthritis pattern, tied to estrogen's lesser-known role in regulating inflammation and pain signaling throughout the body. Nearly 80% of women experience these vasomotor symptoms, hot flashes and night sweats, during this transition, with about half reporting they occur daily, sometimes persisting for 7 to 10 years. Here is a detail that deserves far more attention than it usually gets. A 2025 qualitative study of women and general practitioners found that many women experiencing new mood symptoms during this exact age range either did not recognize perimenopause as a possible cause, or felt too uncertain or embarrassed to even raise it with their doctor, while many general practitioners themselves reported real gaps in their own training around recognizing perimenopausal mood changes. That is not a small oversight. That is a genuine, documented gap in how this transition gets handled in real clinical settings, on both sides of the exam room. Menopause and the correction nobody saw coming. Now here is where 2026 brought a genuinely significant shift in how this entire topic gets discussed medically. For roughly 2 decades, hormone therapy carried heavy boxed warnings tied to increased risks of breast cancer, cardiovascular disease, and dementia, largely stemming from a landmark early 2000 study. Here is the detail that got lost for years afterward. That specific study primarily enrolled older postmenopausal women, averaging around 63 years old, many already carrying cardiovascular risk factors, using one specific oral hormone formulation that is far less commonly prescribed today. The risks identified were real for that specific population, using that specific formulation, in that specific context. What happened next was a broad overcorrection. Those warnings were applied universally, to women of very different ages, using very different formulations, regardless of how closely their situation actually matched the original study population. In November 2025, the FDA formally removed those boxed warnings from topical and systemic estrogen formulations. Current medical guidance, reflected in editorials published through early 2026, now states that systemic hormone therapy is considered safe for women younger than 60, or within 10 years of their final period, provided there are no specific contraindications. Research also points to something worth knowing plainly. When hormone therapy starts within that same window, it is consistently linked to meaningful bone density protection, and the years immediately following menopause are when bone loss accelerates most rapidly, with some women losing up to 20% of bone density in just the first 5 to 7 years. Here is the honest, necessary caveat sitting alongside all of this good news. Hormone therapy is not recommended purely to prevent chronic disease in someone without symptoms, and it is not a weight loss treatment, despite what some corners of the internet imply. This remains a decision made through genuine shared discussion between a woman and her doctor, based on her personal health history, not a universal recommendation for every woman regardless of circumstance. This is general information, not personalized medical advice, and if you are navigating this transition, bringing this specific 2025 FDA update directly into a conversation with your own doctor is a reasonable, informed step. Cycle syncing, separating the trend from the truth. Now let's turn to something you have almost certainly seen across social media, the idea of syncing your workouts, meals, and even your social plans to the different phases of your menstrual cycle. Here is the honest starting point, and it matters. The concept of cycle syncing originated from a popular 2014 wellness book, not from a body of clinical research, and current experts studying this area note explicitly that the specific structured program has never actually been tested in a clinical setting. That does not mean there is nothing real underneath it. There genuinely is some supporting evidence, just considerably more modest than most social media content implies. Research does show mood and energy levels can shift across different cycle phases, and some studies suggest women may feel less confident or motivated during the late luteal phase, right before a period begins. But here is the myth versus reality moment worth sitting with directly. A well-designed 2023 review specifically examining strength performance found current evidence shows no meaningful influence of menstrual cycle phase on strength training results or adaptations over time. Separate research found immune function fluctuations across the cycle are unlikely to meaningfully affect exercise capacity at all. The nutrition side of cycle syncing is even thinner. Researchers reviewing this specific question described the evidence connecting diet timing to particular cycle phases as inconsistent and considerably less developed than the exercise research, with far fewer rigorous studies attempting to isolate cycle phase from all the other factors, sleep, stress, life circumstances, that shift day to day regardless of hormones. As one 2025 analysis pointedly noted, framing women as needing to structure their entire lives around hormonal phases risks reinforcing an old, unhelpful stereotype, the idea that people with periods are somehow less capable or consistent at certain points in the month, a claim the actual performance research does not support. The honest, useful version of this idea, stripped of the overselling, is simply this: paying attention to how you personally feel across your own cycle, energy some days, more fatigue on others, is genuinely worthwhile self-awareness. Rigidly restructuring your entire training program or diet around a generic 4-phase template found on an app, without evidence it improves your actual results, is where the trend currently outruns the science. Bringing it all together. So here is where all of this lands, once the noise gets cleared away. PCOS is a genuine metabolic and hormonal condition, not a personal failing, and strategic approaches like earlier, larger meals and Mediterranean-style eating have real evidence behind them, alongside recognition that mental health deserves attention too. Perimenopause is a real, often under-recognized transition, marked by unpredictable hormone fluctuations rather than a smooth decline, and both women and their doctors are still catching up on how to talk about it properly. Menopause hormone therapy underwent a genuine, significant correction in late 2025, moving from broad fear back toward individualized, evidence-based decision-making. And cycle syncing sits somewhere in between folklore and fact, worth using as a tool for self-awareness, not a rigid rulebook the current research does not fully support. The real thread running through every single one of these topics is the same. Women's hormonal health has too often been either dismissed entirely or oversimplified into a trend, when the actual truth sitting in the research is more specific, more nuanced, and honestly more respectful of what your body is actually doing than either extreme gives it credit for. If this helped you understand your own hormones a little more clearly, subscribe, because we are going to keep pulling apart the health claims everyone repeats but almost nobody actually explains properly. I will see you in the next one.